Hi, my name is Brandon Roth and I am a nursing student at the Miles City College. Today we are going to demonstrate placing an IV for a patient. We have a patient, his name is IV needed. We have their medical record number. These are the physician's orders from Dr. It Will Pinch. The patient has bronchial pneumonia. We're comparing everything with the MAR. We have the date. The patient does have allergies. The patient is allergic to penicillin and latex, so we're going to make sure that we use non-latex gloves for this patient. The first thing we're going to make sure of after verifying the orders and the MAR is that we have the right patient, the right drug, dose, route, time, and the proper documentation once we are finished. The first thing I'm going to do is come into a patient's room. I'm going to introduce myself as their nurse and introduce the procedure that we'll be doing and explain that procedure to them, ask them if they have any questions. Then I am going to perform hand hygiene to make sure that is properly done. The next thing I'm going to do is I'm going to get the patient in a comfortable position. Normally we would raise the bed, but I can't get this table up any further. Instead of just bending over the whole time, I'll probably be sitting down while I do that. We are going to open up some of the things that we need. First thing I am going to open up is the catheter. This is a ClearLink system, continue flow. It's a 10 drop millimeter approximate. Then we are going to open up our saline. Again, we are using a 0.9 sodium chloride. To get this ready, we will remove and make sure that the roller lock is in place. And I'm also going to make sure the safety lock is on as well. I am going to now take off the cap, which allows us to put in our saline, and that is not the cap I wanted to take off. This is the cap. We're going to take the cap off here. I'm going to wipe that clean just to be extra safe. Now I'm going to place it into the IV bag. I'm going to turn it right side up, and we are going to hang our IV on our makeshift pole here, hopefully. Okay. Now, we are going to prime our tubing. I'm going to pinch this here until there's a third to a half of saline solution in there. Going to take off the cap, but keep it sterile. Don't want to touch that. We're going to take off our safety lock, and we are going to run some saline through to check our tubing and also to prime it. We are watching to make sure that there are no holes or kinks in our tubing. We're going to do that into a waste receptacle. Okay. I'm going to put my roller lock and safety lock back on, and I'm going to place the cap back on as well. Now, I did that a little early because what we want to do is our drop factor is 10. The order is for 1,000 milliliters to be infused over 6 hours. So that comes to 166.7, close to 167 drops per hour. Our minute drops are going to be 27.8, so right around 28. So now what we want to do is to get our drop factor. And so we're going to do that 7 drops in a 15-second period. Okay, now we're going to put our lock on so that we keep the roller set. Again, I'm going to place this back on, although since I set it down, I am going to wipe it with a clean pad. Now we have that ready. So I have my patient in a comfortable position. I've raised the bed in the patient's room. Now I'm going to begin the procedure. I've put a liner underneath the patient, and I'm going to place his arm in this position. I'm going to put a tourniquet. This is a lot easier on a real patient. They don't slide. Put the tourniquet on 4 to 6 inches above our injection site. And now we're going to palpate and find our vein. We're going to press down and see if there is flow, if there is return flow to that vein, which there is. Now, if our patient were to have a bunch of hair in this area, we could trim that back before we actually start the IV. But now we are going to go ahead and clean the site, starting in the center and moving outward. Another thing that we can do is take another clean swipe, a sterile swipe, and go up the vein, and that also will bring blood flow back in. I should have put on my gloves before I started this, and so now I would have had my non-latex gloves on because the patient again is allergic to latex. So I'm going to back up a bit here. There is something that I am going to have ready before I do my IV, and that is have my IV lock ready. Because I don't want to have that ready for the patient. I want to be able to do this in a smooth once we stick our patient and start the IV. This is my Lear lock. We're going to clean that off, and we're going to have on here 5 milliliters of saline. I want to keep this side sterile, but I want to make sure that this is ready. So we will leave this here to keep it in a sterile. So now I will start my tourniquet again on the patient. Once again, I'm just going to repeat this step after I've palpated and I have found that vein that I want to start the IV in. At this point, I am going to open up my IV catheter. I'm going to go ahead and inspect it to make sure everything looks fine. I'm going to go on the side of the IV, and I'm going to pierce the skin, and then I'm going to go into the IV. Once I am into the IV, I am not going to continue to place the needle. I'm going to place the catheter in there. That catheter went in there smoothly. Now I am going to take a thin strip of my tape, which I prepared beforehand, and I'm going to do trying to make this as painless as possible for our patient. I'm going to do a chevron lock to initially hold this in place. Of course, we are having blood return at this point, so we are going to quickly prepare this to put our lock on. I am going to take a sterile swab and swab that off. Now I'm going to place this on here. I could either draw back to see if there is blood return in there, or I would just start to flush it. And again, we are flushing with 5 milliliters solution. Now that we have flushed, we are going to take this off, and we have our lock system in there, so we are not losing blood at this time. We are going to take a transparent catheter dressing. I am going to date it, put my initials, and the gauge of the needle was a 20 gauge. Now we are going to place this over the injection site to hold that down. I'm also going to take a 2x2 gauze, and we are going to take this and place it underneath the lock. And now take our tape that we had earlier prepared. To make sure that this is securely taped in place. We want this to be secure so that nothing will pull out that IV from the patient. I apologize, but I would have taken the tourniquet off a bit sooner. Now we can take our IV line. I am going to take another piece of clean sterile. I'm going to wipe that off because now we are going to lock this into the Learlock system. We are now going to take off the safety lock, which now begins our IV solution. I am next going to take some tape, and I'm going to tape Normally I would have had this piece ready as well. But I want to tape this on here so that it does not, if something tugs on the patient's arm or gets caught up in the bed, it will be on there securely. But we want to make sure that we do not have any kinks so that our IV will infuse properly. I also have prepared the patient's name, date, and my initials as the nurse, and I'm putting this on the IV tubing so that we know for the next time it needs to be changed. I will now properly dispose of my products. I will dispose of the needle from the IV catheter into a sharps container, and I will document the documentation that all of this is done by the 6 rights, and I will initial and sign it. And here's the other documentation for date and drugs that we administered, or in this case, we just put an IV of 0.9 solution in. Now we are just going to make sure that everything is infusing properly. We're going to check for any skin that might be raised and make sure that we did not puncture the vein and that the fluid is just going into the patient's arm instead of through the vein. It appears that we are starting with that drop factor being so low, we are starting to see some fluid come out, so we are in the vein and have not punctured it. Now we are going to lower the beds and make sure that our patient is comfortable, and that is it.